I want to begin with just 3 premises, and I'm hoping you're going to agree with the premises of this talk, or it's going to be a very long 40-45 minutes. So let me just start right in. Premise number 1, it's about the money. People talk about quality of care, improving quality of care by removing misuse of imaging from the table, but we wouldn't be the target that we are if it weren't about the money. And I'm not going to go into great detail, but you can see, particularly during the 2000 to 2006 period, when we did attract so much attention, and then the rapid rise from 3 to 5% of all health cost outlays in 1995 to roughly 12 to 15% today. The big thing, and I think it is hard to deny, I've seen figures as high as 33% of imaging is unnecessary. I don't know that that's the right number, but I think those of you who work day in, day out recognize that much of what we do does not contribute to the management of patients and ultimately then cannot contribute to health. Premise number 2, what I have just talked about in the previous slide and our success has led to an anti-imaging bias on the parts of policymakers and other physicians. No specialty in medicine has enjoyed such an extraordinary sequence of new technologies and new applications of older technologies as radiology. We've had the fun toys more than anybody else. Imaging, because it is less invasive and for a number of other reasons less expensive, at least on a per unit basis, has replaced other procedures. They are jealous of the fact that our incomes have risen faster than theirs. In fact, if you look at most specialties of medicine, their incomes have been flat or even declining when adjusted for inflation. More money for radiologists means less money for everybody else. It's hard to understand why, but it's really a fixed pie when you get right down to the economics of healthcare in the United States. And this has led to some very hard feelings. Premise number 3, and this is the one that's really the takeoff for the remainder of the presentation, increase imaging. The rise that we saw particularly in 2000 to 2006, but well before the flattening recently, I believe is a combination of appropriate growth, aberrant incentives, and maybe most significantly of all, uncritical use.